of Mirtha Nyamanda. He's a therapist who helps people with addiction, who have memory problems, emotional struggles. He's also a mental health advocate, and he has works with the Zimbabwe National Drug Task Force, and he also runs Insight Wellbeing, which is trained in helping people through tough times, using a method that's known as cognitive behavioral therapy. We also have our social worker, Tendai Daka. He comes with Mbatira Pamwe Sober Living Space. He also believes that whilst the protocol is there is much that needs to be done, as it feels as if it's more silent than active. We also have Dr. Dewa. You know Dr. Dewa. He approaches rehabilitation using naturopathic approaches and has been working with South Africa at the moment, setting up facilities, one that is actually government funded, and is also hoping that in the future we'll be able to connect patients from Zimbabwe with South Africa so that they can experience complete recovery using therapies such as occupational therapy. We will also have joining us on the line from South Africa. She's no stranger to Detox. She is a medical practitioner. She runs several nonprofit organizations that works with young people based in South Africa, and we want to glean into her experience, her South African experience as far as addiction is concerned. Good morning. You too can send in your questions and also follow the discussion. We want to help us understand what exactly is going on. Starting right away with our discussion, I'm going to involve Mirtha. Mirtha, good morning. You are on the phone. You're on the line. Always a pleasure to have you. Mirtha, you have had the chance of working with our National Drug Task Force. You've also had the opportunity to look into this protocol we're talking about that is supposed to be a SADC tool as far as fighting illicit drug trafficking is concerned. From your experience, Mirtha, what do you think is the commonly used drug in Zimbabwe and maybe even within the SADC region?
Morning, Folake.
Morning.
Listeners. So when it comes to the most common drug of use, you might be actually surprised because it's one that we are actually moving to legalize. We actually have farms in the country that are farming this drug, and that's cannabis. Okay. Now, there's a lot about cannabis that a lot of people are not aware of, because it seems to be a very mild drug in terms of its impact. It's very different from your crystal meth, where those guys who take crystal meth, you can easily tell that this guy is intoxicated, he's high, he's not in the same world as we are. But with someone who's taken cannabis, you could actually have a very heated discussion that seems very in-depth, because actually the people who take cannabis, they take cannabis to help them feel calmer. Again, you want to ask why, what's going on for them not to feel calm. But it has side effects. It has other effects that are more longer term and actually more damaging as well. So we're not just looking at the easy, very quick one that we can tell that this person is high and this is what's going on. So cannabis is the most common but equally harmful. So we need to be very much aware of that.
Yeah. Sorry, Mirtha, I'm seeking clarity there. What I'm aware of is that we as a country are moving to farm industrial hemp, which is not the same as the hemp you are talking about, which is a much higher THC. The hemp that I am more aware of that we as a country are pushing for farmers is one that does not have any THC. In other words, it doesn't make you high, but it does have many benefits that we can use in terms of making bags, for example, construction. It is not the same as cannabis that you are talking about that has the high THC. They're cousins. It's not the same plant. They're cousins. So the reason why I'm disputing this, Mertha, is because on our environmental show, we have profiled farmers and even the Industrial Hemp Foundation in Zimbabwe, and they are different. They are not the same thing. They've been very clear to come on and say they're cousins, but they're not the same plant. This is according to the Industrial Hemp Trust of Zimbabwe.
The practicalities of what we're dealing with here. So if you're then saying smoking the hemp and smoking cannabis are two different things, I think that might be...
You can't actually smoke the other industrial hemp. That's the point. The plant structure is very different, Mertha. You might need to verify this. And we've done extensive programming on this. On Capital, on our environmental show known as Green Morning. They're cousins. You are right that they come from the cannabis plant, but they're different. One has the high THC content, which is the one that you're talking about, which is then smoked. But industrial hemp that we are pushing for as a country is not that hemp. You've got to be clear on that. And I unfortunately, I have to be clear on that because I have run programming on that they're different. They're cousins, definitely, but they're not the same.
But what we're talking about here, for clarity, okay? We're talking Kovo and rape, if you like, okay?
No, we are not. I'm so sorry, Mertha. I have to keep interjecting because we'll be setting the wrong precedents in this. They are not the same thing. They are cousins, right? So as you may know, in plant species, in tree species, in flower species, in animal kingdoms, just like with the cat family, you have the lion, you have the tiger, you have the leopard, but are they the same thing? No, they're not. No, we can't argue that way. I'm so sorry, Mertha. We cannot argue that way, especially issues that are of national scale, where we generalize from a misinformation point of view, it becomes problematic.
What I'm trying to say here is I'm trying to clarify the issue when it comes to what the uses of a plant are various, okay? What we are looking to...
The science, Mertha, in this case, it's not just about the uses of the plant. There are two different plants. You cannot argue and say a tiger and a lion are the same thing just because they're in the cat family. So immediately the argument falls to the wayside. I think we appreciate what you're saying, that cannabis, the one that has the high THC properties, the one that can make you high, is what is one of the major substances that is on the market. I get that. But to then say it is what we are farming and trying to legalize as a country is misinformation and is not correct.
Will not further this argument because I can see where we are with it. But that being...
We are where the science is at, Mertha. We are where the science is at.
I will concur with you for progress sake. So, like I was saying, cannabis is the most used drug, and it's as harmful as the other drugs.
Okay, got you. And from your understanding, Dr. Dewa, how are these drugs being trafficked within the SADC region? You've had the opportunity to work with South Africa. We're trying to call Dr. Andile so that we can get her perspective from a South African side. But from what you are seeing and your connections, how are drugs, cannabis, for example, being trafficked within the region?
Thank you very much. Good morning to the listeners. Good morning to you, Folake. Good morning, Mertha. Good morning, Mr. T, and everyone else. Right. Having had the experience of the other countries, I think basically, if you check our Zimbabwean situation, most Zimbabwean households have got people that are working outside Zim. And in most cases, in festive days, that's when we get them trafficking a lot of drugs into the country. And then as countries, or as different countries, there's also poor regulation of prescription drugs. This is one of the biggest problems. For example, our cough mixtures that are not even registered in this country. We find them in not in the shelves, but in the backyards. And normally, people bring them in big quantities when they are coming back home, or when they are having scheduled their visits in holidays or any other days. They cross the border and bring them into the country. And then also, if you check the drug dynamics, the kingpins in the other world, which I call probably we say the first world, they've got easy transit in countries like with poor immigration facilities. So it becomes a transit, and also countries like Mozambique. Initially, they were just transit countries, but then they tend to be users because the immigration facilities are not as good. So it means they've got porous borders and everything else. What it then means is there's chances of movement of drugs across borders. Yeah.
Okay. And so, as we're still trying to get a hold of Dr. Andile, we want to appreciate how South Africa is responding to drug crisis and how that has a direct impact on us as a country. Dr. Dewa there was just highlighting how having porous borders is a major cause of concern in terms of how drugs themselves then tend to move from one place, one country to another. Tenda, as we're trying to call Dr. Andile, from what you've read about the SADC protocol, what does it say about how it intends to fight drug trafficking?
The protocol speaks of collaborative efforts between the member states, obviously within the SADC committee. So we talk of our demand, we talk of our supply reduction. So basically, it's more of a concerted effort in trying to address this scourge of drug and substance abuse. I'm sure there are a number of countries, Zimbabwe, South Africa, they have come up with a multi-sectoral plan to respond to drug and substance abuse related issues. Yes, with Zimbabwe, we might have been slow to adopt, but last year, our president launched the multi-sectoral drug and substance abuse plan, which is a very great effort and a great move towards responding to what this protocol was speaking to. South Africa has done it before, and they have already a multi-sectoral plan. They have a national strategy that speaks to such issues. But despite all these national strategy documents, supply and demand is still an issue. Supply reduction, obviously, Dr. Dewa has alluded to the porous borders. So that's what the impediment is all about.
And so far, when we're looking at this protocol from 1994, so far, do you feel as if the protocol is alive and is functioning within the region? Let's start with South Africa, that's closer.
I think the protocol lives within the national strategies, but it's not something that is being echoed publicly, that we are replicating the efforts of these protocols. Because if you were to ask some of the policymakers or some of the officials, it might be something that has forgone their mental processes. It's something that we have forgotten about, because each country is now working on its own to address the scourge using its locally designed frameworks, like in Zimbabwe, for example, like in South Africa. But from my point of view, or my worldview, I'm not seeing much of these synergies in these collaborative efforts in trying to address this scourge. You just hear news, South Africa is embarking on these efforts, Zimbabwe is embarking on these efforts, but I'm not seeing these concerted efforts as what the protocol was suggesting or alluding to.
And Martha, as you're listening to this, as somebody who sat at the National Drug Task Force, Tendai, as a social worker, is saying we do have a solid protocol document, but on the ground, we seem to be working in silos. Do you agree with this? That at the moment it seems as if we are working in silos. And how do you think, is it a cultural approach issue? Why do you think that may be?
What a protocol aims to do. A protocol is a strategy of communicate countries working together, sharing information. It's different from a policy. I think what we need in this regard are strong policies, because a policy is then a rule, a law that says you must, whereas protocol is information, awareness. This is what's happening in South Africa, this is what's happening in Zimbabwe. Let's share the issues that we are experiencing as a result of drug and substance abuse. So whilst we have very good plans and very good protocols, what's lacking is the policy. The one that actually says, if you do this, you will be arrested, or if you do this, this is what is going to happen. A very strict and precise regulation with accompanying, consequences for not following.
Yeah.
So, as what Tendai has mentioned, the protocol itself, even the wording of it, when you look at it closely, it focuses on mainly trying to stop the supply, which is your supply reduction, the enforcement laws, enforcement officers, what enforcement officers should be hearing so that they can arrest people who are doing. But importantly, we go back to what's the policy? What's the drug policy in the country? And for everyone to really understand that actually, if you do this, this is what is going to happen. So I think that piece needs clarity.
Yeah. And who is supposed to give clarity to this piece, Mirtha, do you think?
So when it comes to policies, each environment will have its own policy. So you may find South Africa might have a slightly different policy, drug policy to Zimbabwe as a result of where they are. We are landlocked. They are a coastal country. So our policies will differ as a result of where we are. So each country has to come up with its own policy that coincide with its own laws to say this is what is to happen if this occurs. Because again, the policy is the protocol also talks of the SADC countries being transit nations for drugs going elsewhere, and as a result, some of those drugs will either leak into the system and we have a drug problem. But going back to the policy, we as a country need to sit down and say, how do we tackle the drug supply? How do we tackle, and this is what the plan is talking about. So plans in themselves are not as effective without the guiding policy and procedures. So I think there is a gap here in terms of what we're trying to achieve. Can you hear me?
Yes, Mirtha, we are with you.
No, we are here. Thanks, Mirtha. It's Capital 100.4 FM, Harare's Hub. We're trying to understand, as far as addiction is concerned, how regionally we are responding to, this plague, and also how do you think drugs are getting across from different places? For example, we as Zimbabwe are a landlocked country, and yet some of these drugs seem to be coming from elsewhere. How is this happening? We're trying to connect in a minute to a voice in South Africa that is dealing with addiction to understand how they as a country are approaching and how they are responding to the drug crisis. But tonight, maybe to respond to what Mirtha is saying there, that protocol is one thing, but is the idea then to have a regional policy?
All right. From what I was reading from the document, on the preamble, it speaks to the commitment to establish a regional institutional framework for cooperation. All right. Through legislative and social policy. So it's more than just an agreement. It's actually a foundation for the establishment of such institutional framework. So meaning that most of these frameworks that might be designed has to be derived from this protocol. So it's more than just an agreement.
Yeah. So what becomes your role as social workers, your role, Dr. Dewa, as a rehab center, and also Batrapamwe, and also Mirtha as somebody who is sitting on the National Drug Task Force? What becomes your role then in connecting the protocol to a policy, or policies to the protocol?
If I can just reiterate what I was just trying to clarify in the previous comment. When we come on the drug task force, our mandate was to come up with a plan, and we have delivered the plan. The plan has been launched, but without we've basically built a vehicle, but the vehicle hasn't got wheels or proper guidelines in terms of how it functions. So the next step from where we are is where the plan is now linked to a specific policy. Yes, there are laws, the police use certain laws to then arrest people, but we need to have a specific drug and alcohol policy in the country that helps companies, that helps individuals, that helps hospitals understand clearly what happens if someone attends your clinic intoxicated, comes to work intoxicated, drives a vehicle intoxicated. These things need to be very clear so that everyone knows what is supposed to happen. Are they supposed to be arrested? Are they supposed to be taken into rehabilitation? Are they supposed to be given a certain level of treatment? And this even includes our courts, where they can also then direct and order that this person has been arrested under the influence of alcohol and have committed this offense. As a result, instead of them going to prison, we are going to sentence them to a certain number of hours attending drug and alcohol rehabilitation. Are the key things that we are lacking at this point.